and I want to give my cohorts on this committee an opportunity to speak. And if we'll start with Dr. Joyce. Thanks, Dr. Joyce.
Well, thank you, Dr. Wenstrup, and thanks both Congressman Guthrie and Congressman Buchanan and Congressman Wenstrup for being part of the panel here today. When I first found out that I was going to have the opportunity to serve on the Healthy Future Task Force, I thought of one of my patients, Charlie. 10 years ago, I diagnosed melanoma on Charlie's right thigh. And at that time, I did an excision, did an evaluation, and there was no evidence of any disease anywhere else. That was a good prognosis, except for 2 years later, Charlie presented with metastatic disease in internal organs. So at that time, we had only one treatment that was really advocated for, and that was interferon. So he underwent the therapy with interferon, and he completed that, but unfortunately it was unsuccessful. And at the advent of the new immunotherapies, Charlie was introduced to one of those, and he was treated with one of the new immunotherapies. And it went along well, except the tumor continued to progress. So a second immunotherapy, was not originally available when he was diagnosed, was introduced. And today, Charlie is tumor-free. There is no evidence of metastatic melanoma with Charlie. That innovation, that is what we as Americans reach for, and that's what we work for on the Healthy Task Force. We look for individualized, innovative, and personal health care. That's what America wants. That's what our patients, that's what our constituents want. And that's what we've been able to advocate for. Research, talk to the different constituents, talk to the member organizations that have given us the input as we outline a plan moving forward. So I called Charlie. I told him I was going to talk about him today to this group. I said, Charlie, if you didn't have those two different therapies, where would you be today? He said, I'd be dead. I would not be alive if I didn't have these new innovative therapies. And I think that's an important message that we as Republicans, as we outline a plan moving forward, that individualized, that personal, that innovative therapies are the cornerstone of American healthcare. And we have to continue to advocate for that. We have to be able to be part of that. With the treatment subcommittee, we've had the chance to find solutions that work for patients and work for doctors. Medical innovation is what allows us to share these success stories like Charlie's. We need to ensure that government regulations never get in the way of finding the cures that our constituents are looking for. That will mean passing H.R. 19, the Lower Cost, More Cures Act. It will mean expanding access to new and innovative drugs for Medicare patients and incentivizing domestic medical manufacturing to prepare those new therapies and therapeutics that will help save lives. It's a simple goal, but American medicine needs to be unleashed to continue that innovation that helps all of our constituents. I thank each and every one of you for being here today for this innovative and concise conversation. We on the Healthy Future Task Force are dedicated that when we take those next steps, that innovation, personalized, individual healthcare are front and foremost as we move forward.